the fact that I get to go from seeing a newborn baby to an 18-year-old adult. I like the variety that that brings. I really enjoy working with newborn babies and breastfeeding mothers and seeing those challenges that we sometimes run into, some challenges we had with my own son. And he had some difficulty feeding and growing initially, and I really learned a lot from seeing that firsthand and working on that with my wife and my own son. I'm also very interested in mental health. We have a great shortage of mental health providers, and I feel that working with patients with anxiety and depression and ADHD, I can help contribute to that burden that we're seeing in our society right now. Something that I have found helpful in connecting with children and young adults is to really make them the center of attention. As soon as I walk in the room, I talk to them, I have them introduce their parents. I try to have them answer as many questions as they can without help from their parents, which is really fun and funny, especially when it's coming from a 5-year-old. But I think it's not only important for them to start to learn that we're here for them, but it's also important for them to know a little bit about their medical history, like if they have a peanut allergy and why they have an EpiPen and those little things. And I think that's really where that starts. I establish lifelong relationships with patients by really getting to know the patient and their families. This becomes really important as the child grows up, because there's going to be things that come up that they don't want to talk about with anybody, especially someone they don't know well. And when you've had that time to make that connection and get to know the family and the parents and the siblings, it makes it much easier to talk about those things that can be challenging or difficult.